Welcome to Your Pet's Health. I'm Sherry Karabin, host and fellow pet lover. In the coming weeks and months, I'll be speaking with veterinarians about a variety of pet health topics, including common and uncommon illnesses, treatments, and of course, most importantly, preventative care. Let's meet our guest veterinarian, Dr. Todd Banister, who owns Banister Animal Hospital in Kingston, New York. Dr. Banister, thank you very much for joining me here today.
Thank you for having me.
Today we're going to talk about dental health for our pets. We as people are supposed to get regular dental cleanings. Is the same recommendation in place for pets?
It is. Generally, when you have a regular exam for your pet, healthy exam, part of the exam is an oral evaluation and looking at the teeth and the gums and all the structures associated with it. And at that point, a veterinarian will tell you whether your pet has some type of oral disease or oral infection and what level it is. There's 4 levels to, it's called periodontal disease, 1 through 4, 1 being the mildest form, 4 being the most severe, where you can have gum loss and tooth loss and extractions and all sorts of things, and abscessation.
What leads to problems with dental health in pets?
It's the same as it is with us. If you think about it, we brush our teeth 2 to 3 times a day, go to the dentist every 6 months to have whatever plaque and tartar's form removed. You know, it's called subgingival scaling, getting up under the gums, where most of our pets aren't having their teeth brushed. And admitting myself that my pets, if they're lucky, if they get teeth brushed once a month, let alone twice a day. And that's the reality for most pets. So that leads to all the other things I just mentioned.
Is it possible to brush your pet's teeth?
It is, but you have to be careful because some pets will tolerate it better than others. Some dogs and some cats will let you do whatever you want to them, and some won't, and they might bite you, or at least try. But it's definitely worth speaking to your veterinarian about it, asking how to do it, and there are steps to getting your pet used to doing it. The ideal thing to do is to get your pet used to having their teeth brushed at a young age, as a kitten or a puppy, when they're used to being manipulated, having hands in their mouths and stuff like that, and and using the pet toothpaste. The other thing about brushing your pet's teeth is you can't use human toothpaste. You have to use pet toothpaste. Human toothpaste can make them sick.
Let's say that your pet does have to get a cleaning. What should pet owners expect?
A dental cleaning with a dog or a cat is much different than it is with you and I. The physical aspect of doing it is the same. Using your hand scaling, using ultrasonic scaler, then the polishing the teeth and fluoride but they have what they call sealants that they'll apply to the gum line. Actually, we apply to the gum line to prevent foodstuff and bacteria from getting up under the gums. That's where the problem is. But the problem is you and I know what's going on, and we'll sit there and, for the most part, let the dentist or the dental hygienist do it. Dogs and cats have no clue what's going on, and some will tolerate it, but it's actually considered cruel to do it to them awake. So they have to be put under anesthesia to have their teeth cleaned.
If you don't get your pet's teeth cleaned and it's needed, what's the worst that can happen?
Worst case is, well, the least of the things that can happen is they can lose their teeth. But that oral disease is actually an infection. It's bacteria teeming in there, and it's coming up against the gum line, and it's getting into the blood vessel. So now that bacteria can spread to other parts of the body. And any filter organ in the body, the lungs, the kidneys, the liver, the heart, all those organs can be affected because the bacteria can adhere there and cause infections, and you can get much, much worse disease.
So it sounds like dental cleanings are as important as regular checkups.
They really are. Nobody wants to do them. Most veterinarians didn't do this to become dentists, but it's important in the overall health of the pet. And honestly, there's a statistic out there that every animal hospital, if they see 100 dogs in a week, 70% of those dogs will have some oral disease. And it's an even higher number for cats because most people don't look in their cat's mouth. So that's how many pets coming in with some kind of oral disease. And it's because we're not looking in there and we're not brushing their teeth. And I say we because I'm guilty of the same thing.
For more information on today's topic, you can email Dr. Banister at the address on the screen or call 845-331-1050. If you have an idea for a future segment, send me an email at sherrymkarabin@gmail.com. Don't forget to like us, and of course, please share the segment with fellow pet lovers.